Let's talk about epiphyseal injury. It involves the injury to the growth plate seen in pediatric age patients. It is of significant importance as it can lead to growth restrictions or abnormal irregular growth. Coming to the anatomy and physiology of the growth plate is located between the epiphysis and the metaphysis. And coming to the functional anatomy, it has different zones: the resting zone, the proliferative zone, the hypertrophic zone, the calcification zone, the ossification zone. Now coming to the Salter and Harris classification, it is classified into five parts. The type 1 is straight across fracture. There is separation between the physis and the epiphysis. Only the fracture is seen in the growth plate. Example of this fracture is slip capital femoral epiphysis. Type 2 is in the fracture is involving the growth plate plus the metaphysis. And there is a classical radiological sign seen here, Thurston-Holland sign seen in the supracondylar fracture of humerus. Type 3 is when it's involving the growth plate and the epiphysis. And the other example is the lower end of tibial fractures. Coming to type 4, when it's involving the all three structures, the epiphysis, the metaphysis, and the physis. Here it has a poor prognosis seen in the lateral condylohumerus fracture. Here the treatment is open reduction and internal fixation. Come to the type 5, seen in the crush injuries, fall from height, and it has a worst prognosis of all the types. So this was all about epiphyseal injuries.